Welcome back to our 5-year nursing tutorial YouTube channel. In the last class, I have explained in detail regarding the topic of spina bifida, and also I have given MCQs. 5 MCQs I have given. In this class, I am going to tell the answers. Here the answers are: first one is A, second one B, third one is D, fourth one is A, and fifth one C. In this class, I am going to explain in detail regarding the topic of fetal circulation. This is also called as prenatal circulation. Prenatal circulation. Here, this fetal circulation or fetoplacental circulation starts on 21st day. 21st day, it's going to start. First, we'll see the difference between adults and the fetus. Adults and then fetus. Just we'll see the difference. What happens in adults? What happens in fetus? Here, this adults is also called as postnatal. And this one is prenatal. Prenatal circulation and then postnatal circulation. Here, in adults, first pure blood is going to supply to the heart. Pure blood supply to the heart. This is pure blood supply to the heart. Here in the fetus, pure blood first is going to supply to the liver. Pure blood supply to the liver. And then here lungs mature. Here in adults lungs are mature, and then here lungs are immature. Lungs non-functioning. And then here what happens? Lungs makes O2 and then removes CO2 from the blood. Here in adults. Here in fetus, lungs mix CO2 and receive O2. And then here bypass channel absent. Here bypass channel present. Bypass channel present. This is just difference between adults and fetus. First we'll see adults. What happens? Just we'll see in the adults. In heart, there are 4 chambers. In heart, there are 4 chambers. This one is a right atrium. This one is a right ventricle. And then this one is left atrium. This one is left ventricle. Here what happens? From the left ventricle, pure blood is going to supply through the aorta. Through the aorta, pure blood is going to supply. Then what about the impure blood? Here, superior vena cava. From the superior vena cava, from the inferior vena cava and then superior vena cava. This one is the superior vena cava, this one is inferior vena cava. Here impure blood, deoxygenated blood is going to supply to the right atrium. Here, right atrium, there is an impure blood. And then what happens here after that? This right atrium deoxygenated blood gets entered to the right ventricle through the tricuspid valve. Here, through the tricuspid valve. After entering deoxygenated blood in the right ventricle, after that what happens here? Here again this deoxygenated blood goes to the lungs from the pulmonary artery. From the pulmonary artery. Here deoxygenated blood that used to goes to lungs through the pulmonary artery. What happens here? Here pulmonary circulation takes place. This is very important. Here lungs are functioning and then deoxygenated blood converting to the oxygenated blood. Here blood is going to get oxygenated and this blood is going to supply to the directly to the left atrium. This blood goes to the left atrium. From the lungs, it goes to the left atrium through the pulmonary vein. Here, blood is oxygenated. Oxygenated blood goes to the left atrium. From the left atrium, it gets entry to the left ventricle through the bicuspid valve. Here, blood enters to the tricuspid valve. Here, in between the left atrium and the left ventricle, there is a bicuspid valve. Here, oxygenated blood from the left atrium that is to get enter into the left ventricle through the bicuspid valve. After that, here from the aorta, it's going to circulate to the whole body parts, organs, tissues. Here, this is aorta. And then this one is a pulmonary artery. This one is the inferior vena cava. This one is the superior vena cava. And then this one is the pulmonary vein. This circulation is about adults. This circulation takes place in the adults. Next we'll see the fetal. What happen in the case of fetus. Here fetal circulation starts from the intrauterine life, and then here uterine artery from the placenta is going to supply the blood to the fetal or the fetus. Here in the fetal circulation, there is this one placenta contains two parts. One is maternal part, another one is a fetal part. Maternal part and the fetal part. Maternal part contains intervillous space, and the fetal part contains villi system. We'll see just the diagram. First, maternal part, that is intervillous space. Here, intervillous space. And then villi system. This one is the villi system. Here it is full of blood. It is filled with blood. In short, I write names here. This one is a intervillous space. This one is the villi system. Villi system. Here, weight of the placenta is 500 gram. Weight of the placenta is 500 gram. Then total volume of the placenta is 500 ml. 500 ml. Here in the placenta there is 500 ml of blood used to get present. And then in that 500, 150 used to present in the intervillous space. Here 150 ml. 150 ml of blood is present in the intervillous space, and then in the villi system 350 ml of blood is to get present. 350 ml of blood is to get present here. Total 150 plus 350 is 500 ml, and then here this one umbilical fetal circulation contains 2 umbilical artery and 2 umbilical vein. 2 umbilical artery and 2 umbilical vein. Here is the vein. This is first one is a right umbilical vein. After that, this one is a left umbilical vein. What is the function of vein here? It carries oxygenated blood from the placenta to the fetus. That is 80% O2 saturation. This one is a vein, umbilical vein. It carries blood from the placenta to the fetus. That is about 80% O2 saturation. 80% O2 saturation. And then here 2 umbilical vein and then 2 umbilical arteries to present. These are the 2 umbilical artery. What is the function of umbilical artery here? Again, it carries blood from the fetus to the placenta. Deoxygenated blood it carries again to the placenta. That is umbilical artery. These two are the artery, these two are the vein. What happens here? During the fourth month, this first right umbilical vein used to get disappeared. In the fourth month, this used to get disappeared. What is the remaining thing? Only the left umbilical vein is remaining. It carries blood from the placenta to the fetus. Here it is going to disappear in the fourth month, and what is the remaining thing here? One umbilical vein is remaining, that is left umbilical vein. Now pure blood is transferred to the liver, not heart. It is in the fetal circulation we are studying. First, pure blood supply to the liver, and then maximum blood bypass the ductus venosus. Maximum blood bypass the ductus venosus into the inferior vena cava. Here ductus venosus bypass the ductus venosus. Here maximum blood bypass the ductus venosus, that is into the inferior vena cava. Here through the liver, that bypass ductus venosus. This is the first bypass channel. Here ductus venosus is the first bypass channel. This one is the first bypass channel in the fetal circulation. That is, keep it in mind, that is first bypass channel in the fetal circulation is ductus venosus. Many times this have asked in the competitive exams. That is ductus venosus. Here bypass channel, that is ductus venosus, comes to the inferior vena cava. Again from the inferior vena cava it goes to the right atrium. It had 4 chambers. It had 4 chambers. Here this one is the right atrium, right ventricle, left atrium and then left ventricle. Here from the inferior vena cava the blood goes to the right atrium, and then here in between the right atrium and the left atrium there is a little bit opening will be present in between right and the left atrium. This opening is called as foramen ovale. This opening is called as foramen ovale. And then here this is the second bypass channel. This one is the second bypass channel. What is the first bypass channel? There, that is that one bypass the ductus venosus. That is the first bypass channel. Here this one foramen ovale is the second bypass channel. Here from this foramen ovale, from the right atrium to the left atrium, there will be the transfer of 2/3 of blood. Here 2/3 of blood gets transferred from the right atrium to the left atrium through the opening that is called as foramen ovale. Here 2/3 blood gets transferred and the remaining 1/3 that comes to the right ventricle. Here 1/3 blood is to come here and then 2/3 blood goes to here. And then what happens here? After 2/3 blood goes to the left atrium. Here from the left atrium it goes to the left ventricle, aorta. That is 2/3 blood is going to get transferred to the left ventricle. That is aorta. Here aorta. After that this one is the ascending aorta. Here aorta branches. That is ascending aorta. After that arch of aorta. After that descending aorta. After that thoracic aorta. After that abdominal aorta. It comes to the abdominal aorta, and then here from the abdominal aorta there is an internal iliac artery and then external iliac artery. Here external iliac artery, and then internal iliac artery. After that this comes to the hypogastric artery. And then from hypogastric artery it goes to the umbilical artery. From the umbilical artery again it goes to the placenta. placenta. Here, listen carefully. Whenever the blood gets transfer from aorta, and then these are the branches, and then that is reached to the umbilical artery. When that blood is going to reach umbilical artery, that time O2 saturation is 50 to 60%. Here O2 saturation is 50 to 60%. This is O2 saturation. O2 saturation. And then what happens here? In this case, here right ventricle is there, right? Here it's going to join. Here already lungs are immature, not functioning. That's what. Here pulmonary artery is going to rejoin. It's going to join from the aorta. Here. This one is the pulmonary artery. This one is the aorta. This one is the aorta. And then this one is the pulmonary artery. Here pulmonary artery is going to join to the aorta, descending aorta. It's going to join by bypass that is creates one bypass channel, that is ductus arteriosus. Ductus arteriosus. It's going to create one bypass channel, that is ductus arteriosus. Ductus arteriosus. And then this is the third bypass channel. This is the third bypass channel. Here, what is the first bypass channel? First bypass channel is the ductus venosus. Ductus venosus. This one is the first bypass channel. What is the second bypass channel? Foramen ovale. Foramen ovale is the second bypass channel. And what is the third bypass channel here? That is ductus arteriosus. Ductus arteriosus. This is the third bypass channel. We'll see the bypass channels. First one is ductus venosus. First bypass channel is ductus venosus. Here, it connects connection between umbilical vein and inferior vena cava. Umbilical vein and inferior vena cava, and then bypass the liver. Bypass the liver and close after birth. Here we close after birth. After birth, here there are two main closing. One is physiological closing, another one is the anatomical closing. First we will see the physiological closing. Physiological closing, it is 5 minutes after birth. 5 minutes after birth. And then anatomical closing. Anatomical closing, that is 7 days after the birth. 7 days after birth. It is the ductus venosus is going to close, going to disappear. Then what is the remaining thing? That is remnant. What is remnant? Remnant means after closing ductus venosus, what is going to remain? That is ligamentum venosum. Ligamentum venosum. It's going to remain. This is all about the ductus venosus. Here, second bypass channel is foramen ovale. Foramen ovale. Here, connection between right and left atrium. Bypass the lungs. Bypass the lungs. We'll see the closing. First one is the physiological closing. Physiological closing 5 minutes after birth. 5 minutes after birth, it's going to close. And then anatomical closing. Anatomical closing 1 year after birth. 1 year after birth, and then after closing foramen ovale, what is the remnant? What is the remaining thing? What it remains? Remnant is fossa ovalis. This is the remnant. After closing foramen ovale, what is going to remain? That is called remnant. Remnant is fossa ovalis. This is the second bypass channel in the fetal circulation. And then we'll see the third bypass channel, that is ductus arteriosus. Ductus arteriosus. Connection between pulmonary artery and aorta. Pulmonary artery and aorta. That is descending. Yes, bypass the lungs. Bypass the lungs. And then we will see the closing, physiological closing and then anatomical closing. First one is a physiological closing, that is 5 minutes after birth. And next we will see the anatomical closing, that is 3 months after birth. 3 months after birth. After closing the ductus arteriosus, what is the remaining thing? What is the remaining one? That is remnant is ligamentum venosum. Ligamentum venosum. This is the third bypass channel. It's going to disappear, it's going to close physiologically and also anatomically, and then after that remaining thing is a ligamentum venosum. Sorry, it's not a venosum, it's an arteriosum. Ligamentum arteriosum. Ligamentum arteriosum. After that, we'll see the closing of umbilical artery and umbilical one. Here, umbilical artery, that is first closing. Here, what is the remaining thing? Umbilical artery is going to close. After that, remaining. What is the remaining thing? Remaining is median umbilical ligament. Median umbilical ligament. And then second one, that is umbilical vein. That is second closing. And then here remaining thing is ligamentum teres. Here we have completed the fetal circulation. Here I have given MCQs on the topic fetal circulation. First question is, fetal circulation functions were developed on which week? And then second question is, fetus connect placenta by umbilical cord. Normally umbilical cord contains, these are the options. Here the third question is, the amount of fetal blood flow per minute through the placenta at a term is, these are the 4 options. I given. And then fourth question. After the birth of the baby, foramen ovale close and it becomes. These are the four options. This one is the fifth question. That is, after birth in a normal neonate, the ductus arteriosus becomes. Previously it is ductus arteriosus. After that it becomes. These are the four options. Let me know through your comments. Please like, share and subscribe to my YouTube channel.